Welcome to today's Explainer. Look, if you're joining me right now, there's a really good chance you've just been handed a diagnosis that has completely flipped your world upside down. Today, we're going to demystify gout. We're going to validate the absolute mind-numbing pain you're probably feeling right this second, and most importantly, we're going to build a highly manageable, step-by-step battle plan together. Think of this as your personalized blueprint for getting your life back. Let's get right into it.
I want to start by acknowledging exactly what you might be going through right now, because let's be honest, that excruciating first flare-up, it is completely unforgettable. It usually strikes without any warning whatsoever, often in the dead of night, and it leaves you staring down at a joint that feels like it's quite literally on fire. If you're terrified and in absolute agony right now, just take a deep breath. You are in the exact right place.
The classic first sign of gout that so many new patients experience is an agonizingly swollen, bright red foot. In the medical world, when it hits that first joint of the big toe, we call it podagra, and that happens in up to 60% of initial attacks. The pain is sudden, it's severe, and it hits its absolute maximum intensity in just 4 to 12 hours. I know it's completely disabling, but hear me when I say this, it is also highly treatable. Section 1. Understanding your diagnosis. When you literally can't even pull a bedsheet over your foot without crying out in pain, it feels incredibly isolating. But I promise you, you are far from alone. In the UK alone, gout affects roughly 25 in 1,000 people. To put that into perspective, that accounts for 250,000 doctor visits every single year. So, while it feels awful, this is actually a very common condition, and it follows a highly predictable pattern.
And that pattern usually progresses in some very clear phases. It starts with a silent, asymptomatic buildup that can honestly last for years. Then, bam, you get that sudden acute attack, which is probably what you're dealing with right now. But here's the really good news. After this acute attack subsides, which usually takes about 3 to 14 days, you're going to enter an asymptomatic intercritical period, basically a pain-free window. And that window is exactly where we're going to take control so this never happens again.
Section 2. The culprit. Uric acid.
So, what's actually causing this? The root cause is a state called hypouricemia. To make this super simple, think of uric acid in your blood kind of like sugar being poured into a glass of water. If you stir in a teaspoon, it dissolves, no problem. But if you just keep pouring and pouring, eventually it hits a physiological point where the water just can't hold anymore. The sugar stops dissolving and clumps at the bottom. Well, in your body, when uric acid stops dissolving, it forms these incredibly sharp little crystals right in your joints.
Seriously, if you look at monosodium urate crystals taken from joint fluid under a microscope, they literally look like glowing needles or tiny shards of glass. When those needles embed themselves in your joint tissue, your body's immune system goes into absolute overdrive attacking them. And that battle, that's what triggers the sudden, severe inflammation and swelling you're experiencing. But here's an absolutely crucial warning, and it's a huge relief for a lot of people to hear. Just having high uric acid isn't the whole story. Actually, in about 10% of cases, your uric acid levels might appear completely normal on a blood test during an acute attack. Crazy, right? So if your doctor diagnosed you clinically, but your blood tests look totally fine today, do not second-guess the diagnosis. Hyperuricemia is definitely the underlying cause, but those blood levels can totally trick us during an active flare.
Section 3. Calming the acute attack.
Okay, priority number 1, putting out the fire. These 3 steps are your acute battle plan. First up, rest the joint, elevate it, and use ice packs to help ease those symptoms. Second, you want to start your prescribed anti-inflammatory meds immediately. Treatments like NSAIDs are way more effective when you start them within 48 hours of feeling the symptoms. And third, and please listen to this one carefully, if you happen to already be on daily uric acid-lowering drugs when a flare happens, do not stop taking them.
When it comes to immediate medical options for suppressing that pain and inflammation fast, your doctor is probably going to prescribe full doses of NSAIDs. But hey, if you have a history of stomach ulcers or kidney issues that make NSAIDs a bit risky for you, don't sweat it. You've got powerful alternative options like colchicine or corticosteroids. Whether they're in pill form or an injection straight into the joint, they are fantastic ways to extinguish that flare-up quickly.
Section 4. Your long-term battle plan.
Once the immediate pain is gone, we've got to make sure it never comes back. And here's where so many newly diagnosed patients get tripped up. You have to strictly separate the drugs used for an active attack, like your NSAIDs or colchicine, from the drugs used for daily prevention, like allopurinol. Think of it this way. Acute meds are for putting out the active fire, while chronic meds actually lower the sugar in the water. They're what fireproof the house for the future.
Let's talk about your primary shield, allopurinol.
With this, timing is literally everything. Your doctor is going to wait about 2 to 4 weeks after your acute flare subsides before starting it. Why the wait? Because if you shift those uric acid levels too quickly during an active attack, it can actually make the flare worse. Plus, as it starts dissolving those old stubborn crystal deposits, it can trigger these annoying mini flares. And that's exactly why your doctor will usually prescribe a low-dose shield of colchicine for the first 3 to 6 months, just to protect you while your body adjusts.
I need you to memorize this magic number, 360. Your ultimate target is getting your serum uric acid below 360 micromoles per liter. Why that specific number? Well, the data clearly shows that below that threshold, new crystals just cannot form, and gout attacks become incredibly unlikely. So your doctor will slowly adjust your allopurinol dose month by month until you safely hit that target.
A comprehensive medical strategy maps out exactly how your doctor will walk you through the entire process, starting from the acute phase all the way to long-term chronic management, and finally into lifestyle modifications. And speaking of lifestyle,
Section 5. Taking charge through lifestyle.
Now, your doctor isn't trying to punish you here, I promise, but certain foods are just incredibly high in purines, which your body breaks down directly into uric acid. Reducing your intake of red meat, oily fish, shellfish, and sugary, fructose-rich drinks will take a massive burden off your system. And I've got to shoot straight with you here, alcohol, and specifically beer, poses the absolute highest risk. Cutting back on beer is honestly one of the most effective everyday changes you can possibly make.
But hey, it's not all about restricting yourself. Here's a really cool positive twist. Did you know that incorporating low-fat milk into your daily routine actively helps protect your joints? It acts as a natural urate, which is really just a fancy medical way of saying it actually helps your kidneys flush out that excess uric acid a lot faster. Pretty awesome, right?
And beyond just your diet, there are some huge everyday lifestyle wins you can focus on. Optimizing your weight and aiming for a normal BMI takes a ton of pressure off your body's metabolism. Staying consistently well hydrated is key to keeping those kidneys flushing out the bad stuff. And working with your doctor to manage blood pressure and high cholesterol, those are absolute vital pillars in keeping those painful crystals dissolved and out of your joints for good.
When you put it all together, the medical pathway proves that all of these roads, whether it's managing the acute flare, starting your daily preventative therapy, or making those lifestyle tweaks, they all lead to the exact same beautiful destination: resolution. Gout is absolutely not a life sentence of continuous pain. If you stick to this plan, getting complete resolution and reclaiming your quality of life is 100% achievable.
You now hold the blueprint to outsmart this condition. We've decoded the diagnosis, we know exactly how to put out the immediate fire, and we've built a long-term shield using both medication and lifestyle changes. So take charge, work closely with your doctor to hit that magic 360 number, and make sure that this agonizing, terrifying first attack is the only one you ever have to endure. Thanks so much for joining me on this explainer, and here's to a healthy, pain-free future.